Hello, my name is Adam Riedel. This is my BSN 246 focused assessment video on a post-op patient. In this scenario, we're going to pretend that we're on a med-surg floor the morning after a surgical procedure on this patient. In this case, we're just going to pretend that she had a laparoscopic cholecystectomy, which in that case is getting your gallbladder taken out through what are called lap sites. So she'll have 3 or 4 little small incisions that we'll be assessing and palpating during this focus assessment. So I'm going to go into my room, introduce myself, say hi, knock knock, close the door, start washing my hands using some hand sanitizer. Can I ask your name and birthday?
Amy Riedel.
Sweet. So Amy, what we're going to do is a little bit of a head to toe assessment, just see how you're doing after your gallbladder was taken out yesterday. So on that note, how are you feeling?
Good.
Does your stomach or abdomen hurt at all?
Yeah, it's a little sore.
What number would you give that pain if you could give it a number?
4.
A 4? Okay, so I would say a 4 is pretty moderate. Most of the times I wouldn't be medicating someone unless they were saying they were above a 5. A lot of the times in outpatient surgery we'll want to have people to be at a 5 or lower to have them either going upstairs or going home. So I would say a 4 is pretty adequate. Do you feel like you would need any pain medication for that pain?
No.
All right, cool. So what I'm going to do is I'm just going to assess your vitals. I'm going to put this pulse ox on your finger, and I'm going to monitor your blood pressure here. And hopefully this doesn't give us a bad reading with this shirt on, but I think we'll be okay. So, alright, so she's at 110/76, which is pretty good. And the pulse ox on her finger was reading a pulse of 77 with SpO2 at about 98% on room air, which is beautiful. In a non-teaching scenario, I would sometimes do a pulse right here and then be looking at the respirator, so we're going to do that right now. But I wouldn't normally say something like that if I was actually doing this in on a real setting with a real patient. So right now I'm just taking your radial pulse. Cool. So I got 7, and then times that by 2, so 14 breaths a minute, which is lower, but that's going to be fine. Could be indicative of a little bit of discomfort that she's feeling in her abdomen, not wanting to take as many breaths right there. So what we're going to do now is I'm going to just kind of start from our full head to toe assessment. I'm going to start kind of in the top half of you here, and then we're going to go all the way down. So I'm going to just kind of check your skin, see if you have any dry skin, any cracks, any abrasions, any lesions, making sure the integrity of her skin is looking good. Do you know where you are right now?
Yeah.
Yeah, where are you?
The hospital.
Okay, and do you know what month it is right now?
March.
Yeah, and can you tell me who the president is right now?
Biden.
Yes, ma'am. All right, so she is ANO times 4. I'm going to assume the 4th one already because she told me her name already, so that makes me know that she is oriented to herself. So I'm going to make sure that her eyes are doing okay. So I'm just going to shine this light in here, and I want to see if your pupils contract or dilate when I don't have the light on them, which they look okay. And then I'm going to just inspect her nose and her nose. So I'm going to palpate her sinuses and have her kind of flare. Breathe in through that nose. Go with the other one. All right, and then go ahead and go up with your nose. I'm going to just inspect inside of her nares, see how they're doing. And then go ahead and open your mouth. Close your mouth, tighten your jaw. Frown for me. Smile for me. And then open your mouth one more time. Stick your tongue out. Keep your mouth open when you start to that. Okay, I'm going to look and see you. See your uvula. It looks good. Nice moist mucosal membrane in there. No dryness or anything like that. Any pain or tenderness in there?
No.
Just see those big old tonsils, that's it. And then I'm gonna have you turn your head to the side, and I'm gonna be, in a normal setting, I would be using an otoscope, but obviously pen life's what we got going on right here. Look for some earwax intaction, or otherwise known as cerumen, and I'm gonna kind of pull and see if I can see anything in here. Does that hurt at all when I'm pulling there?
No.
I can't really see much of her tympanic membrane with this pen light, but nothing looks abnormal or out of the ordinary with her ears, so that's great. What we're gonna do now is I'm going to assess your cardiovascular and your respiration. So we'll just keep that shirt on for right now. I'm just gonna have you take a couple big deep breaths for me. I'm gonna just listen to your lungs, okay? So just how you're doing, just big deep breaths. Give me another big one right there. One more. Then go on your backside here and your posterior. You're doing great. One more there. Cool. Nice. Nice. Hold on. Okay, hold up. And one more here. Give me that one more time. Good, almost passed out, didn't you? Alright, so we're just gonna look at your heart. I want to listen to how your heart's doing, so just breathe normal, just regular. Hear that nice love dub. I don't hear any indication of a murmur or anything like that, so that sounds real nice. Same thing, I'm going to go down lower here a little bit, excuse me. I'm also going to check with the bell also here. Hearing my nice lubbin' and dubbin', so don't hear anything abnormal, that's great. So no contradictions with your heart, sweet. What I'll have you do now is, if you can, go ahead and lay back a little bit for me. I just want to make sure that our thing is doing okay here. Just want to make sure that I'm still recording, which I think I am. Okay, so I'm going to assess, palpate, and auscultate your abdomen. We're going to keep this cover on you here for right now. In a normal sense, I would actually be wanting to assess these surgical sites. I would want to make sure that they are clear from purulent drainage. That, is some sort of serosanguinous fluid could be particularly okay depending on if they use things within the surgery, but we're going to make sure that her sites are clear, dry, and intact, which we're going to say that they were because I don't want to open her gown up here. And I'm going to auscultate her bowel sounds to see how that's doing for any abnormal bowel activity. So I'm going to just go in all four quadrants and I'm just going to listen. In a normal setting, I would be listening for a lot longer than when I'm going to be putting the stethoscope on here, especially if they were hypoactive bowel sounds. And I can just kind of tell that she's a little bit hungry, which is normal, especially since she hasn't eaten after her surgery, right? So we're gonna just palpate her abdomen a little bit here too. Is that tender at all?
Yeah.
That's tender, okay. It's soft. I don't feel any distensions or anything like that. Is that making your 4 worse than a 4, or is it still at about a 4 with your pain level when I push like this?
It's about a 5.
It's about a 5, a little bit worse there. Okay. Do you think that you're going to need any medication for that, ma'am?
No, I think I'll be fine.
Are you nauseous at all?
No.
Okay, good. So while you're laying here, I'm just going to do a couple range of motions. Go ahead and push your arms out like that, and then towards yourself, going up. All right. And then bring your arms like so, and then push back down towards the bed. Yeah, good range of motion there. All right, this leg goes up. Yeah, a little weak. This one also, we'll go with that as well. Push your foot up. Yeah, again, okay. Bring him down to the ground. Okay, like you're pushing up with your feet. Stepping on the gas. All right, I'm gonna take your shoes off so I can check your pedal pulses real quick. So checking pedal pulses on both of her legs. I'd like to also check her dorsipedal and tibial pulses here while I'm down here. I would also sometimes check the femoral pulse. I feel like that's just a little bit an inappropriate area right now, so I'm going to bypass that, especially due to the fact that I can feel adequate pulses lower down here. I would know that the femoral is going to be okay in that regard as well. I've also already assessed her radial pulse while I was doing the respiration, so I won't be doing that a second time. You can stand up again here, ma'am. Okay. So, one more thing, the last thing I'm going to do here is I'm just going to check and make sure your skin is doing okay, which is something I could be doing while I'm doing the entire assessment, but I'm going to be checking her capillary refills, making sure that that is less than 3 seconds, which indeed they are, and during the entirety of the assessment, I'd be looking for skin breakdown, any lesions or things like that, which I didn't see in that regard. Do you have any questions or anything like that, ma'am?
No.
Okay. I would document the assessments, document the vitals that I did, perform hand hygiene, and give her a call light and make sure that she had the ability to reach me if needed. Thank you.